Welcome and thank you for joining Research Nova Scotia's information session for the new Health Investigator Grant Competition Expression of Interest stage. My name is Megan Belfontaine. My pronouns are she, her, and I'm the Director of Research Support here at Research Nova Scotia, and I'm your host for today's session. Before we start this afternoon, I'd like to begin by acknowledging that Research Nova Scotia is in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This land is governed by the treaties of peace and friendship that were struck in 1725-26 that have established a long-standing relationship between the nations. We are all treaty people. I also want to recognize that the people of African descent who have lived and contributed to Nova Scotia have been here for more than 400 years. Before we start, I have a few housekeeping items to go over. First, we'll ask that you please enter any questions into the Q&A section found at the bottom of your Zoom screen. You may enter questions at any time during the presentation, and either myself or my colleague, Kelly Hancock, will do our best to answer all questions either throughout the webinar or at the end of the webinar. Second, I'll also note that today's webinar is being recorded and it will be available along with copies of the webinar slides on the Research Nova Scotia website early next week. With that, I will turn off my camera to preserve a little bit of bandwidth and we can get started. So today's webinar will cover a variety of topics, including a brief introduction to Research Nova Scotia, an overview of the new Health Investigator Grant, the application and review process for your expression of interest, otherwise referred to as an EOI, and finally, a short Q&A session. Research Nova Scotia was founded in 2019 to support, organize, and coordinate research in our province. Our research strategy has been organized into 4 areas: improved quality of life for Nova Scotians, healthy people and healthcare systems, climate change adaptation and resilience, and sustainable bioeconomy. These 4 areas represent some of the most pressing needs for the province. Each area is made up of 4 corresponding missions, which help to give shape to the ways research can contribute to achieving progress for Nova Scotia. This mission-oriented approach to research means we start with what we want to accomplish and build a research agenda and coalition of partners and projects to help achieve these goals. We seek to support creativity, diversity, and ingenuity in the research community's responses to our mission challenges. All submissions for the new Health Investigator Grant must be aligned with our healthy people and healthcare systems mission area of our strategy, which will be demonstrated through the alignment with the priorities established for this competition. As mentioned, Research Nova Scotia often works with partner agencies to develop opportunities to help us achieve our shared goals. The new Health Investigator Grant is one of these opportunities. Funding for the new Health Investigator Grant is provided by the Nova Scotia Department of Health and Wellness. Each year, senior management of the department determines the research priorities, and it is upon them that we build this competition. Research Nova Scotia is mandated to support research that reflects these provincial health research priorities. There are 3 priorities established for this year's competition, which are research contributing to improvements in the delivery of health services, such as creating opportunities for team-based care, enhancing access to people-centered, flexible, and quality healthcare, improving the efficiency and effectiveness of health professionals in diverse care settings, and enabling healthcare providers to work in their full scope of practice. The second priority for this year is research addressing factors that influence the well-beings of Nova Scotia, such as promoting the health of an aging population, treating or preventing chronic diseases, caring for the mental health of citizens at all ages, impacting the social determinants of health, and ensuring equity in the provision of healthcare. And the final priority area for this year is research addressing personalized care to improve health outcomes for Nova Scotia's increasingly diverse population. All submissions for the new Health Investigator EOI must clearly address at least one of the 3 priorities listed. The 2024-25 New Health Investigator Grant supports early career researchers who are engaged in research that focus on the efficient and effective delivery of healthcare to Nova Scotians. This grant will provide up to $100,000 over 2 years for researchers who are within the first 5 years of their first-time academic appointment in Nova Scotia. Funding provided will support the establishment of independent programs of research, improve competitiveness for awards from national and other external funders, and expand the potential for early career investigators to make significant contributions in their field. As mentioned, this funding for this grant is provided by the Nova Scotia Department of Health and Wellness. We have implemented 5 changes to this year's competition that you should be aware of. First, in order to align with tri-agency standards, Research Nova Scotia will honor eligible leaves of absence, for example, illness, maternity, parental, at twice the amount of time taken. Second, researchers who have recently moved to or returned to Nova Scotia and those who are new to the field of health research are no longer eligible to apply for the new Health Investigator Grant unless they meet the definition of an early career health researcher. Third, applications exploring biomedical research topics will once again be accepted in this year's competition. Fourth, we have moved the question around potential beneficiaries of this research to the EOI stage. As a reminder, this question asks you to demonstrate how you will engage with Nova Scotians who will benefit from your research. You should also provide information on how these potential beneficiaries help to shape your research activities. This question will be particularly important for any researchers proposing to work with vulnerable or underrepresented populations. And finally, Research Nova Scotia will be accepting reviewer suggestions at the EOI stage this year, rather than with the full application. We will now start to dive a bit deeper into the eligibility criteria for this grant opportunity. First, to apply for a new Health Investigator Grant, the applicant must be an early career health researcher within the first 5 years of a first-time academic or research appointment at a Nova Scotia university or college, or have an appointment with research responsibilities at an affiliated hospital. It is important to note that the 5-year window is adjusted to account for instances where a researcher has had an eligible delay in research. Eligible leaves like illness, maternity, parental, or bereavement are credited at twice the amount of time taken. Professional leaves, for example, training, sabbatical, or administrative leaves, will not be credited. Second, the primary applicants must have an eligible academic or research appointment. I will go into this in a little bit more detail in the next slide. Third, during the full duration of the grant, the primary applicant must reside in Nova Scotia, work at a Nova Scotia institution, and maintain an eligible academic appointment. Finally, current establishment grant and/or new Health Investigator grant holders may be eligible to apply, provided that their grant ends prior to December 31st, 2024. So for the purposes of the new Health Investigator Grant, Research Nova Scotia considers the following to be academic appointments: tenured appointments, tenure track appointments, or probationary tenure track appointments. If you're with NSCC, you're a research scientist. We also include limited term appointments. And it's important to note that while applicants with limited term appointments are eligible to apply, if they're funded, the applicants will be asked to provide an institutional confirmation that their term end date is after the estimated grant completion date. And we'll work with you to get that information. They also may be an affiliated scientist, medical staff, or other appointment or affiliation approved by a senior official, for example, a CEO or VP research. For the purposes of the new Health Investigator Grant, adjunct and instructor positions are not considered to be an academic appointment. If there are any questions regarding your eligibility, please contact Kirsten Mosier, our research support officer, at the email address found at the end of this presentation. So in terms of subject matter eligibility, as I noted, Research Nova Scotia is mandated to support research that reflects provincial health research priorities. Any new Health Investigator Grant submissions must address one or more of these priorities that we discussed earlier in the presentation. New Health Investigator Grant holders may be awarded up to $50,000 per year for up to 2 years. It is also important to note that all grants are subject to a 10% financial holdback. All EOI applications must be submitted through Research Nova Scotia's Jura system by 1 p.m. Atlantic time on Thursday, July 4th, 2024. Jura will not allow submissions that come in after this time, and any application that is not submitted by this date and time will be marked ineligible for consideration. We strongly recommend that you do not leave your submission to the last minute. Technical errors and computer shutdowns will often occur at the worst possible moments, and exceptions for submission will not be made under any circumstances. The EOI application will undergo a first round of review, and we anticipate that invitations to submit a full application will go out in August 2024. So in between these two, I'll also host another webinar similar to this, just to talk about the full application nuances. And for any of those invited to submit a full application, it'll become due on October 3rd, 2024. Final funding decisions will be available in December 2024, and the funding will be available to start in January of 2025. Now, the big question is, how do you apply for this award? The first step is to confirm your eligibility criteria. Be sure to review the criteria mentioned earlier in this presentation to ensure that you are eligible for the award. Applicants who do not meet the eligibility criteria will be deemed ineligible and will not be able to move forward in the competition. The criteria can be found on the Research Nova Scotia website, in this slide deck, and embedded on the online application form in Jura. If there are any questions regarding your eligibility, please contact Kirsten Mosier, our Research Support Officer, at the email address at the end of this presentation. Next, you must reach out to your institution and confirm any internal deadlines. All EOI submissions must undergo institutional review and receive approval before they will be considered by Research Nova Scotia. Applicants should connect with their research office well in advance of the submission deadline to confirm any internal deadlines and processes. These deadlines are often several weeks in advance of the Research Nova Scotia deadline, so please be sure to reach out as soon as possible. Next, you must register for a Jura account. Jura is Research Nova Scotia's online grant management portal. All applications must be submitted through this portal. As a first step, you'll want to navigate to Jura from the Research Nova Scotia website, select the For Researchers dropdown, and click on Jura Login. Once you reach the Jura homepage, you may log in using existing system credentials if you've applied for a previous award, or if you're new to the system, click the Register button to sign up. Once you're on the registration page, you will first need to look up your organization. This should be the organization at which you have your eligible appointment. If you select the wrong organization at sign-up, please reach out to our Jura help desk and we will be happy to resolve the issue. When entering the name of your organization, a drop-down box with all matching entries will appear. Be sure to select this entry from the pop-up box to properly associate your account with the organization. Finally, you will complete an Equity, Diversity, Inclusion, and Accessibility self-declaration. EDIA strengthen the research community and the quality, social relevance, and impact of research. EDIA-informed analyses, systems, and practices ensure barriers faced by the underrepresented or disadvantaged groups are identified and addressed, which in turn enhances the integrity of application and selection processes, strengthens research outputs, and increases the overall excellence of research. All information provided to Research Nova Scotia will be kept strictly confidential and will not be shared with third parties. Oh, sorry about that. If you do not wish to self-identify, you have the option to select Prefer Not to Say for each question. You must select an option and save your responses for your questionnaire to be marked as complete. Doing so fulfills the mandatory requirement for completing the EDIA self-declaration. You may change these answers at any time by following the instructions outlined in the How to Complete an EDIA Self-Declaration in Jura document on the new Health Investigator landing page on the RNS website. When all of your fields are complete, you'll click the Submit button to create your account in Jura. Shortly after submitting, you will receive an automated email from Smart Simple with a link to set your password. Once your password is set, you will need to agree to the Jura privacy policy and terms of use and will be directed back to your user homepage. As noted earlier in the presentation, the EDIA self-declaration is required of all applicants. Users who have an existing Jura account will first need to log into the system with their existing credentials, click on the personal profile link on the homepage, and finally select the Equity, Diversity, Inclusion, and Accessibility tab. As with the previous option for new users, if you do not wish to self-identify, you have the option to select Prefer Not to Say for each question. You must select an option and complete this questionnaire in order to submit your application for the new Health Investigator Grant. So as you've successfully registered for Jura, you've completed your EDI self-declaration, you can now start working on your application. From your Jura homepage, you'll want to select the Funding Opportunities section. From here, select the New Health Investigator Grant opportunity and click Apply Now to launch your application. Before you begin your application, you will need to click the Save Draft button. Doing so will assign you a unique application number in the system, which allows you to return to working on your application at any time. The guidelines for this opportunity can be found at the top of your application in Jura. Please be sure that you have read and understood the guidelines for the opportunity before you are completing your application. You can navigate to the various sections of your application using the tabs located at the top of your screen, and any questions marked with an asterisk are mandatory. It's also very important to note that Jura will not automatically save your progress, so we recommend that you save draft frequently in order to avoid losing any work and also to enable you to return to work on your application at a later date. In any subsequent session, you can find your draft application in the In Progress Application section of your Jura homepage. As noted, while working on your application, you must follow the guidelines for this opportunity. The detailed guidelines document can be found in the Research Nova Scotia website on the New Health Investigator Grant landing page, and they can also be found at the top of your application in Jura. This document provides details on what is expected for each of the fields in your Jura application. We strongly recommend that you take the time to read the guidelines thoroughly in order to set your application up for success. While you're completing the application, there are a few areas where you may have some confusion, so I just wanted to take a few moments of today's webinar to review these in detail. First, we'll look at the plain language summary. The plain language summary should provide a clear and concise overview of the project, written in language suitable for a non-scientific audience. When writing the summary, imagine you're explaining your work to a stranger on the street who does not have any knowledge of your subject matter. As such, whenever possible, we ask that you avoid using jargon, abbreviations, or technical terms. If you must use them, be sure to provide a clear explanation. The summary should briefly describe the issue or topic that is to be researched, the overall research objectives, the research question, how this work will benefit Nova Scotians, and the activities for which you are requesting funding. If funded, Research Nova Scotia will use the plain language summary for communication purposes, and it will be published on our website. Next, we'll look at your CV submission. All primary applicants must submit an up-to-date, validated PDF version of a common CV in either the CIHR academic or CIHR project biosketch type. We recommend that you start this process early, especially if you are new to the CCV system, as it can take some time to receive your PIN and enter all of the required information. Any questions related to the CCV system should be directed to CIHR Centralized Help Desk at the contact information provided on this slide. Finally, we'll look at the project alignment description submission requirement. The project alignment description should be the main focus of your EOI submission. This document must provide a clear and concise description of the proposed research project that includes demonstration of the project alignment with one or more of the research priorities developed for this competition, which we've detailed earlier in the presentation, and demonstration of the potential impact of the delivery of healthcare in Nova Scotia. Your EOI submission will be reviewed by a committee comprised of representatives from the Department of Health and Wellness. This committee will determine whether the proposed project topic aligns with these research priorities. As such, applicants are reminded that this project alignment description should be written for a non-scientific and non-specialist audience. Once your application is complete and ready for submission, we recommend that you review PDF overview that can be downloaded by clicking on the EOI summary button. It is strongly recommended that you review this carefully before submission to ensure that the information provided is accurate and appears correctly, as this is the version of your submission that will be provided to the review committee for consideration. If you should choose not to move forward in the competition, you may withdraw your application at any point before the deadline by clicking on the withdraw button. When your proposal is ready for submission and you're happy with how it looks, select the Submit button from the bottom of your form. If successful, you will receive a confirmation email and your submission will be viewable under the Submitted Application section of your Jura main profile. However, if you try to submit your application without completing one of the mandatory fields, you will receive a submission failed message that will direct you to correct the information in your application. You must then navigate to each section of the application and correct these errors. This may mean entering text into a field you missed, uploading a document to the correct field, or you may receive an error message relating to your EDIA self-declaration. To resolve this error, click on the Applicant Home button, click on your personal profile, navigate to the Equity, Diversity, Inclusion, and Accessibility tab. You will then need to complete the questions noted in your submission failure message. This may be regarding Indigenous identity, your racialized minority group, disability, gender identity, language, or age cohort. As noted, you may choose to select Prefer Not to Save for any or all of these categories. Once completed and saved, you will need to return to your application and try to submit again. We strongly encourage you to submit your applications as early as possible to ensure that technical errors, such as these, do not prevent the submission of your application on time. The final step in the EOI application process is obtaining your institutional approval. As noted, all submissions must receive institutional approval before the application deadline. This process is completed via an institutional representative in Jura, and your institutional deadlines may differ from the Research Nova Scotia deadline. Once you hit submit, your application will move into a submitted EOI pending validation status. This will prompt one of your institutional representatives to log into Jura and review your application. They may request changes to your submission before they will approve it for Research Nova Scotia's review, or they may approve it in the system. Once your application is approved by your institution, it will move into a submitted EOI status. Once the Research Nova Scotia submission deadline has passed, the New Health Investigator EOI review process starts with Research Nova Scotia's eligibility check. Research Nova Scotia staff will assess all applications to determine whether they are complete and meet the eligibility criteria for this opportunity. Applications that do not meet basic administrative eligibility criteria for the competition will be marked ineligible and not provided to the Department of Health and Wellness Committee for consideration. Next, any eligible EOI submissions will be reviewed by a committee comprised of representatives from the Department of Health and Wellness. This committee will determine whether the proposed project topic aligns with the research priorities. Finally, Research Nova Scotia will notify applicants of all of the EOI status decisions and will invite successful applicants to submit a full application for consideration. Hopefully, this webinar has provided you with the answers to most of your questions. However, I want to take a few final moments to address a few of our frequently asked questions. So the first is, am I able to submit multiple proposals as the primary applicant? Unfortunately, no. Applicants may only submit one proposal as the primary or co-primary applicant. Applicants may, however, act as a co-investigator on multiple proposals. Second, do all primary applicants need to be an early career health researcher? Yes. All primary and co-primary applicants must be within the first 5 years of a first-time academic or research appointment at a Nova Scotia university or college, or have an appointment with research responsibilities at an affiliated hospital. Third, am I able to include citations with my expression of interest submission? Absolutely yes. Applicants may include in-text citations in their project alignment description, and you should upload these citations into the attachments section of your application. I would advise you to keep in mind that EOI submissions will be reviewed by a committee of government representatives and therefore should be written for a non-scientific audience. And for this reason, citations are not required for the EOI submission. Third, for eligibility, how are leaves of absence calculated in terms of an academic appointment? And for early career health researchers, eligible leaves will be credited at twice the amount of time taken. And we've gotten quite a few questions on this, is how are these first 5 years calculated? So the primary applicants must have been within the first 5 years or less of their first time eligible academic appointment between January 1st and December 31st, 2024. I provided a few different examples of how the eligibility period is calculated on this slide for your reference. But if you have any questions about your particular eligibility situation, please feel free to contact Kirsten Mosier at the email provided at the end of this presentation. So after all that, I'm still a little bit confused. Who should I contact for help? So if you require support with your application, please don't hesitate to reach out to the appropriate person here. So any technical issues, if you're having trouble with Jura, either logging in or maybe a field is acting a bit strangely and you're not sure why, we'll ask that you reach out to our help desk. So it can be reached at the phone number here or at the email here. If you have any issues with your CCV, reach out to the CCV centralized help desk, or any other questions about eligibility. As I've mentioned a few times, this is Kirsten Mosier. She's our research support officer, and her email address is provided here. So that wraps up the formal part of my presentation. I'd like to thank you for taking the time to join us for today's webinar, and I'll now open the floor up to questions. So as a reminder, just to type any questions into the Q&A feature here on Zoom. And if I don't get to your question before the end of the session, I'll do my best to reach out via email directly after this webinar. I'll turn my video back on and stop the share to see what we have for questions. So I'm seeing a few here. All right. So the first question I'm seeing here is, do budgets at the full application stage need to be exactly 50,000 or less in each of the 2 years, or is it fine to exceed 50,000 in either year as long as the total does not exceed 100,000? So we will ask that if there is a situation in which you will have more than 50,000 in either year 1 or year 2, that you submit that with a rationale. And it's something we will take into consideration and review during the full proposal stage during the scientific merit review. So it is possible that you could have not absolutely even, but we do ask that if possible to make it as even as possible, but we will consider exceptions under certain circumstances. Just please provide a good detailed rationale with your budget justification at that stage. And then we have a question of, could you please send the slides to me? Absolutely. So the slides will be available on the Research Nova Scotia website, along with a recording of today's session. So it will be on the New Health Investigator landing page. There's a section there for webinars. So if you click on that, it will bring you to that, that space. And then I believe we're hoping to have it up earlier, but that will definitely be early next week at the latest. That you can find that on our website. So then we have questions, does the PI need to set up the application in Jura, or can it be submitted by another team member on their behalf? So I would recommend that you do submit it under your profile in Jura. Once it's set up, and that's mainly just so you can complete the EDIA declaration section, and so it's associated appropriately. Once you've logged in and kind of set up, launched the application, if you'd like to have someone else that has submission and viewing privileges, feel free to reach out to us. So I would ask that you reach out to our help desk with the name of that individual that you would like to submit on your behalf, and their direct email address that you'd like us to set up there. So we can absolutely do something like that as well. Okay, so this one says, when you refer to health projects, is it only about medical medicine, or can it be an engineering process? Like the removal of contaminants from water or air that directly affect human health or around Nova Scotia or Canada. It can absolutely be something a bit more innovative. The main point that I would kind of say here is that, so I'll go back, hold on, to our priorities here. So it would be your role to really give us a convincing argument as to how those would help to meet or how they would align with one of these 3 priority areas. So I absolutely will not say yes or no either way. That'll be the committee's decision. But as long as you can successfully convince the committee of government representatives that your project is aligned well and will help to meet these 3 priorities, then you're in good shape. Okay, this is a great question, very timely. It says, what are the policies of using generative AI when composing the application? So right now, we don't have a formal policy around the utilization of generative AI. it will be read through by everyone, as long as it can still your work. So if you're using it to say, help write some pieces of it, that's okay, but it should still absolutely be able to say it is your work. It's something we're still kind of in the process of developing our policy on. But as long as you are still comfortable in saying, like, this is my work and I will put my name on it and it is accurate and great, then we don't have anything expressly prohibiting that at this point. Can you please list all the required attachments for the EOI? And do we need to submit a letter of support from a community partner with the EOI or just in the full application? So at the EOI stage, there's only one required attachment. Everything else will be entered directly into Jura. So the only required attachment will be the primary applicant's CV. You have the option to upload any other kind of application. So for instance, your citations, or if you did have a letter of support. However, that letter of support would only be required at the full application stage. Okay, so someone's asking, can you further explain what institutional review is? I initially thought it was REB, but it's not. I'm confused what it is. So all applications that are submitted to Research Nova Scotia have to be approved by your institution. So whichever institution you would be proposing to hold your research funds or at which you have your eligible appointment would need to know, one, that you're submitting this New Health Investigator Grant EOI to us, and would need to read through it and actually make sure that it aligns with their priorities as well. So whichever institution that you are proposing to submit your EOI through, I would reach out to them quickly as soon as possible, just to see if there's any internal deadlines that need to be met. And they will kind of let you know what their internal processes are. And then once they do their kind of overall review, then they say, yes, this is good to go from our perspective, and then they submit it through to us. Okay. This is asking, does the PI or co-PI have to be in a healthcare field? No, it doesn't necessarily, like, your background is not required to be in healthcare. It would likely help. And I will kind of quickly mention this isn't something that we talk about at the EOI stage, but one of the things we strongly recommend, especially because this is a new health, new career investigator award, is at the full application stage that you engage with a mentor. So it's something that we don't require, but do strongly recommend. So that person would kind of help you navigate the health field in Nova Scotia. So it's not required that you're in healthcare field, but if you have that really strong mentor, that would be very helpful, especially for someone who's not directly in healthcare. So can co-investigators be from universities outside of Nova Scotia or outside Canada? Absolutely. You don't have to have your full listing of team members or anything at this stage. It's a pretty quick overview of, like, here's what I'm thinking. But if you are invited through to the full application stage, you will be able to add all of your co-investigators, and they can absolutely be from outside of Nova Scotia and outside Canada. So do we need to have the institutional approval before July 4th, 2024? Yes, you would need to. So I know that most of the institutions have internal deadlines. I don't know what they are myself, but please reach out to them to find out what deadlines they have. So usually it's about a week before our deadline that they want to kind of look over. They'll work with you, kind of help you to develop a few things, make sure everything looks aligned. So that often happens well before the July 4th deadline. So just reach out to them as soon as possible, and I'm sure they'll be happy to help out with that. Okay, so how do we find out the person who would give us an institutional review? I would say to please reach out to either myself or to Kirsten, and we would be able to help. We'd be able to connect you with the right person for your institution. Oh, and this is good to know because someone says, I think Dalhousie's internal deadline is tomorrow. So that is good to know for anyone on the line from Dalhousie. Thank you for that. So someone's wondering if I don't have an email address with the institution yet, can I use a different email address for Jura? Absolutely. So if you wanted to use a Gmail or something else at this point, that's absolutely fine. If at if at a future date you'd like to kind of change that in the Jura system, just send our help desk a quick email and we can change that on our back end. This is a great question. How much do the research priorities change from year to year? I would say fairly significantly. So the one thing this year that you probably heard me mention early in the presentation was that this was one of the years where we were accepting biomedical research projects again. We actually hadn't accepted them for the past 3 years. So we're very excited to have that door open again this year. And they do change fairly significantly year over year as the Department of Health and Wellness kind of changes their mind on things and figures out what's most important to them. Okay. So in Jura, there's a question on the ethnic or racial identity, and one of the options is African Nova Scotian or other racial minority. If one is an African immigrant, are they considered in the African Nova Scotian definition or the other racial minority? So in that case, I will leave it up to you to declare your identity. It's not something that we have firm definitions on what that means. So it is something more of like, how do you present yourself? And also, what does the proof of an institutional approval look like? A letter. So it actually is done within the Jura system. So once you hit submit, they get a space that kind of props up in their Jura profile. They'll go in, they'll have access to view your entire application, and then they have the opportunity to say yes or no. So that's all done automatically through the Jura system. It's nothing that you have to worry about getting a letter or something like that outside. Okay. Excellent. So someone else, the institutional review deadline for NS Health is by the end of the day on July 3rd. So thank you for that. Do you need to have the academic appointment at the time of the submission of the EOI or by the time the funding begins? You would just need to have it by the time the funding begins. So in those situations, I would just say to reach out to your what we usually do. So if I was looking at the eligibility on your application and I saw that it didn't start until say November this year, I would reach out to the institution through which you're submitting your new health investigator grant. And I would just say, hey, Dr. Smith submitted this application. Can you please confirm that they will be having this academic appointment on this date? So as long as the institution knows that you're going to have an appropriate academic appointment, that is great. How many pages words does the alignment with priority document have to be? Okay, that is a good question and one that I cannot remember off the top of my head. So I'm just going to open up our handy dandy guidelines and scroll down here. So we are looking for the alignment summary. So the project alignment description here, you have 1,000 words. Oh, thank you. I forgot that I had stopped sharing my screen. So here's the screen. I went to the Research Nova Scotia website here, and I downloaded the EOI guidelines, and then went down to the project alignment description, which says it's the maximum of 1,000 words. It'll also count directly for you in your application in Jura, so you'll know how many words it is. And it does count words, not characters. Excellent. We have another person chiming in that the institutional review deadline for sane effects is the end of the day, July 3rd, meaning that the applicants need to press submit before that time. Exactly right. Okay, someone's asking, do you mind clarifying the definition of an early career researcher regarding eligibility for the EOI? Curious, as a physician working as both a hospitalist and private family doctor along as an assistant professor within Dow could be considered. Potentially, so that specific eligibility question, I would ask that we kind of forward through to Kirsten so that we can review it in a bit more detail. More than likely. So if I go back here to the eligibility requirements. So as long as you're in your first 5 years of a first-time academic appointment, so I'm looking at that assistant professor ship with Dow, that would be an eligible academic appointment through the assistant professor is an eligible academic appointment through these tenured, usually it's tenured or limited term appointments. And the only kind of asterisk I'll put on that is assuming that their previous appointments would not have been an eligible appointment. So if they were, yeah, so I'm looking like private family doctor really wouldn't have any kind of research affiliations at the hospital. So as long as none of those were affiliated with something else that would have been an eligible appointment, that should be okay. But again, I would recommend that you reach out to Kirsten to discuss the specifics of your eligibility. So that the first few years of your academic appointment were purely clinical with no research. Do they still count towards the 5 years? Yes, they would, unfortunately. So as long as it is one of these kind of academic appointments, it would still count. And someone's asking, do postdoc fellowship appointments count in these first 5 years? So a postdoc, unless it was a type of tenured position, assistant prof, likely would not count. But again, if it's a specific question, I would recommend reaching out to Kirsten because it's always difficult to answer them without all of the details. And just make sure EOI should be sent through internal institutions for review first, not to Research Nova Scotia, which is correct, but it's all done through the Jura system. So you'll log into Jura, you'll fill out your application, you'll hit submit. That then brings it to your institution. They do their review, and then they hit, and then that comes through to Research Nova Scotia. So it's all done through the Jura system. So you don't have to worry about doing things twice or in 2 different systems at this point. All right. That's looking like the end of the questions that I have listed here. I'll just give it another minute or so, take a little bit of a drink of water, and if there's anyone else who has a burning question, feel free to pop it in there, and I'll also just bring back up my email address. Yeah. And if you have any other questions, you can go there. So I was reading a question here. So someone's seeing this, the EOI deadline is July 4th, 2024, but June 20th, Dal and the Romeo deadline. So I would definitely recommend reaching out to Dal to confirm the difference there. It's very likely that you have to submit something through to Dal that gives them the details of what you're planning to submit through to us, and they may do something different. So I can't speak to Dal's process on that, but definitely reach out to someone at Dalhousie for that. All right. Well, thank you everyone for your time and the really great questions that I've had come up today. It's been very interesting, very timely questions as well. If you have any other questions that come up after this seminar, feel free to reach out to me at the email address here, and I look forward to hearing from you and reading all of your very interesting proposals. So thanks so much and have a great rest of your afternoon.